Hello, I'm Selma Schimmel and welcome to the Group Room. Today I'm joined by Dr. Jonathan Goldman, a medical oncologist and lung specialist at Premiere Oncology in Santa Monica, California, who is here to discuss advances in science that are changing what we know about cancer. Dr. Goldman is here to discuss our final segment. It's part of a three-part series dealing with personalized medicine and biomarkers and how they help in the diagnosis, prognosis, and treatment of cancer. Now, in the last two segments, we introduced the concept of personalized medicine and explained the importance of biomarkers, discussed how biomarkers can help guide cancer treatment, and gave an overview of the biomarker testing process. In this segment, we're going to discuss how biomarkers influence cancer treatment decisions and how further research is expanding the clinical landscape of personalized medicine. Welcome back, Dr. Goldman.
Thank you, Selma.
Let's talk about the future of biomarker testing and identifying additional tumor types that have biomarkers.
This progress, probably beginning in breast cancer and then soon thereafter going to other tumor types like lung cancer, stomach cancer, a rare tumor, gastrointestinal stromal tumor, has really spread to many different kinds of cancer. And I would say in every tumor type, scientists are trying to learn about biomarkers.
What does this look like amongst clinicians and researchers and scientists? Because as medicine, as oncology becomes more and more of this interdisciplinary specialty, what is the overlap? Because you've got all these specialists. It's the surgeon and it's the pathologist and perhaps the interventional radiologist or whatever. Talk to us a bit about what that looks like.
I think we're learning that what we call multidisciplinary care, where all of these subspecialists come together to optimize our treatment for a patient, is crucial to our cancer care. Part of that is a meeting that we call a tumor board or a multidisciplinary meeting, usually on a scheduled basis. We get together to talk about specific patients, to talk about our understanding of a tumor. And it's a time where we educate each other on recent advances in science, recent developments in surgery, radiation, radiology, and chemotherapy.
But we mustn't leave out the researcher, the scientist, the PhD scientist that is critical to this research process.
That's right. That's right. And it's people talk about going from the bench, the research bench, to the bedside, to patient care, and then bringing information back again to the research bench.
In the laboratory setting, especially in the early stages, how does one research a biomarker?
As we discussed, there are many different kinds of biomarkers, and each one has a different pathway, I would say. Some of them are part of the diagnosis or screening of cancers, and most of those are proteins that are on cancer cells at an increased number compared to normal cells. And we learn that those proteins can be found in the blood, for example. And that is in many ways like an epidemiological study where you compare patients with cancer to patients without cancer. In contrast, we have other biomarkers that tell us about the biology of a cancer, and that is a long process in many examples. Where we learn for a specific tumor, a certain percentage of the cases are driven by specific mutations. And in the past, that process could take decades. Science is accelerating so quickly that now that process may take as short as a couple of years. From the identification of one of these driving changes of cancer, we then learn how to test for it, how to do it in a reliable way, in a way that can be extended to the whole population of patients with this type of cancer.
Are biomarkers also useful in monitoring treatment?
That's right. Some of these tests we use teach us about how active the cancer is based on blood tests usually. And we find that on successful treatment, the biomarker may change, often goes down. And that can be used to follow the benefit of a treatment, to follow how long we could give someone a treatment break, for example, and when it might be appropriate to change treatment.
How often would you then test the patient?
It depends on the situation. It can be as often as every 3 to 4 weeks, or sometimes spread out over a greater time period. In general, we do not want to overreact to a single blood test, but we tend to get a trend over time to learn more about the information and how treatment should be adjusted for that patient.
So how does a physician decide what might be the right treatment for a patient based on that patient's biomarker results?
Well, that can be a very complicated process. Often for a specific tumor type, you might get an array of biomarkers, somewhere between 3 or 5 or 7 test results that could tell you what do you expect or what are the probabilities of benefit to different therapies. And we combine that with other information, such as what we know the side effects would be, the schedule of the therapy, how do we want to strategize about future therapy options. But putting all the information together, the biomarkers are an important measure of this patient's specific cancer and not the whole group of cancer.
What about costs related to biomarker testing? What does a patient need to know? What goes on with insurance companies?
This will depend on specific insurance and on the specific tumor type. There are some examples where it's been well agreed upon for many years that a biomarker is an important part of cancer treatment and diagnosis, and therefore it would be covered by all insurance companies. There are other examples where things are recently proven, or one might say not even yet fully proven, and those are may differ from one insurance system to another. I think it is an important question before the testing's undertaken to understand whether this is something to look into further or not.
So in closing, Dr. Goldman, because you are, while you've been doing medical oncology practice for some time now, you still represent the younger generation of medical oncologists. What is it like for you, and what does it mean? There's such a paradigm shift clinically with the introduction of personalized medicine and biomarkers. What is it like for you as a clinician, and how do you see the future, and how is this going to impact you and your colleagues?
The changes that we've been discussing, the development in our understanding of cancer and how that helps inform our treatment, are really the most exciting advances in cancer therapy for quite some time, and are what makes being a cancer doctor at this point exciting. We have learned more, I think, in the last 10 years than we learned in the prior 30, 40 years or more. And it does seem that now I can see how important that is to my patients, as they're doing better than people did not too long ago. So it is a way that I know that patients that I'm treating now are doing better than they used to, and I hope in the future they'll do even better than they're doing now.
And I imagine the whole academic curriculum in medical oncology is changing as a result of our understanding of biomarkers and personalized medicine.
That's right. I think now we can describe what it means to have a cancer and what it means for a normal cell to become a cancer cell much better than we could not too long ago. This is probably going to inform future treatment, but more importantly for our patients now, it's affecting their care here and now.
Thank you, Dr. Goldman, for taking time here on the Group Room for these last 3 episodes, talking to us about the role of personalized medicine and biomarkers in cancer treatment.
Thank you. It was a pleasure.
Cancer patients, family and friends, you can visit canceritspersonal.com, thegrouproom.tv, and vitaloptions.org for more information.